Usually what happens is an eagle's injured, for instance, hit by a car or flies into a power line, gets some type of an injury, and if the people can capture it by throwing a blanket over it, convincing it to go into a crate, then usually it's taken to a wildlife rehabilitation center or to our hospital where we assess it. Unfortunately, with a lot of cases, the fracture may be too close to the joint, may be open, infected, may be beyond repair, in which case the bird is humanely euthanized. Otherwise, the other step that we take would be to anesthetize the bird, pin or repair it, whichever way we feel it can be done. And after that, it goes to the rehab center for the real work, which is bandage care, physiotherapy, feeding it, exercising it, getting it to the point of release. Good night. And it goes in through their lungs, and then it goes from there into their air sacs and even out, extending into their wing bones, and then back up and out again through the lungs. So anesthesia can be a little trickier, so we have to be a little more careful on. Just I have to get feathers out of the way in order to make a nice sterile incision. It's called retrograde pinning. So I found a big fracture and I placed a large pin, as large as could fit in the diameter of the inside of the bone, so that it sits on the together snugly. So now what I do is I pull this up so that the other end can hopefully be snugged into the fracture on the other side. Then we cut the pin and let it heal lined up. Once it heals, then hopefully we'll be okay with there we go, back on it. Because some of it is, you're just going by experience and feel. We may or may not have it in the right spot. It felt good though. I've been fooled before. The little bone should be somewhat lined up, and it should just heal on its own. And it's not as critical as the big bone. Even if it didn't heal, if the big bone is there, it would still be okay. There's also a bunch of fragments in the fracture site. We chose to leave most of them there. I took one out. So they'll stay there. They may sort of stick back on and heal, or it could be that they'll get resorbed. We do have to watch for infection, because certainly it's not the most sterile surgery, plus the fracture itself did poke out through here. So it is considered contaminated, even though we've given antibiotics. And he'll stay on antibiotics for a while. There's still a risk of infection, although wild animals do seem to be much more resistant naturally to a lot of infections. But we still take certain precautions. We've had a number of eagles released. I think we're well over 200 so far, and it's always really rewarding when you see them fly off. But it's a lot of work involved, and for everyone that we do release, there's certainly more that are injured beyond hope. But we feel it's a release from pain if we're able to euthanize them rather than let them slowly suffer out in the wild.